Thank you, John, and thank you, Minister, for opening this. I'm going to do a small presentation. I'll try not to bore you too much with too many numbers and data in there, but it is important, as John was saying, about data-based policy. But it's also really what is the leitmotif, and Minister Georgiadis emphasized this, but he also was doing this when he was the Minister of Economic Development of Greece. Health security is very, very important. We need to ensure now in Europe, in a more unstable world, that we have security. And the manufacturing sector that we have here in Greece, but also in Europe, is critical to that. So I'm going to take you a little bit through that. As John mentioned, the generic medicines industry is, we've celebrated our 30th anniversary as an association, but we're a relatively new industry, actually. But this industry is ultra critical to public health. Without this industry, for the main therapy areas, they've reduced the cost for healthcare systems, for healthcare budgets from 37% to 12%, mainly for chronic diseases and for anti-infectives. What this means is that this is affordable for patients and for healthcare systems. So this is really ultra critical. Now, what's important to underline is that this industry has grown so much in Europe that we have now 70% of the supply of prescription medicines depends on the generic industry in Europe. It's 90% in the United States. And this means that our role in healthcare has also evolved, and that really the security of supply is one of the most critical components. So investments in manufacturing here in Greece, in the rest of Europe, is critical to public health. Now, let's talk about some of the problems. Minister Georgiadis mentioned this as well. In Europe, we are experiencing a massive wave of shortages, and this is driven, as the minister pointed out, largely by the pricing policies or procurement policies that we apply in Europe. And what is happening is the number of suppliers is diminishing over time. So what you see on this slide is that 66% of shortages are in markets where there are very few suppliers of generic medicines. So this is the root cause of the shortages of medicines. So if we want to encourage fewer shortages, we need to encourage more manufacturers to participate in the market. And I think those measures that Minister Georgiadis mentioned about sustaining the generic industry are very, very important. The EU has adopted a critical list of medicines. This is around 300 medicines that are ultra critical for the functioning of hospitals, for the functioning of healthcare systems. 9 out of 10 of those medicines, of those critical medicines on the EU list, are generic medicines. This shows you again, from a criticality perspective, how important these medicines are. But let's look at one of the problems. Over the last 10 years in Europe, 26% of generic medicines have been withdrawn from at least one market, many from many markets. This is even worse for antibiotic medicines, which of course loom high on the critical medicines list. And it's even worse for possibly some of the most important medicines, generic oncology medicines. So it's showing this extreme consolidation going on in the European market, which is very, very bad for the risk of shortages. Now, what do we do about this? How do we change this? Already in Greece, we've seen efforts to invest in the manufacturing sector, to support more sustainability of the generic market. This is very important, but we also need European solutions. So here you can see on this map the investments by our sector across Europe, and I'm very proud that Greece is one of the leaders of this investment in European security of manufacturing supply. But we also need to invest in affordable innovation so that we can treat patients better. Most medicines are actually not adapted to patients, and I'll give you some examples here. There's a change in the EU pharma legislation that would enable innovation around off-patent molecules that would treat a number of challenging conditions. For example, for some cancer treatments, the patients cannot absorb the cancer drugs, which means, of course, they do not function. So we need to adapt those cancer drugs to the morphology of the patients to make sure they will work in them. Also, I see there are a lot of women in this audience. Almost no older medicines are adapted to women, which means typically they will be overdosed for women. So if women take insomnia pills, they're likely to have a car accident the next day because that pill is overdosed to them. But it's not just insomnia medicines, all kind of cardio medicines, other things. They're not adapted. We need to adapt these treatments. We also need to help the hospitals. The hospitals are struggling to get doctors, struggling to get nurses. We need to adapt the drugs to make it easier to administer at home or facilitate the work of hospitals. So this is something that really is important to support in the European reform of the pharmaceutical legislation. The last thing, Minister Georgiadis, when he was the Minister of Economic Development, was one of the first ministers in Europe to say after COVID, we need to invest in our manufacturing in Europe. We've seen the risks of being dependent on places outside of Europe who may not always be our friends. But we need to do this not just in Greece, across Europe. We have now huge numbers of shortages of medicines because there is no sustainable investment in manufacturing, because there's too much cost pressure on the generic industry. So we need to have adaptations, as Minister Georgiadis pointed out, to make sure it is sustainable, that it's profitable to sell these very inexpensive medicines. In many countries, unfortunately, it is not, and this is why you're seeing these shortage problems. Another problem, here you can see, is over the last 20 years, we've seen the delocalization of a lot of production outside of Europe. Now, we are trying here in Greece and other countries to reshore this production, but it is very, very challenging. And I'll give you an ominous warning about some of the challenges. Right now, in France, there's a major company, the biggest generic company, which will remain unnamed. But it faced a massive clawback tax in France in 2023. The clawback tax tripled in France in 2023, basically rendering most of the business of this company very marginally or totally unprofitable. Now that company is up for sale because it's no longer profitable. The most likely buyers are Asian producers who are going to delocalize all of the production outside of France and outside of Europe to Asia. This is the consequence of unsustainable policies and what we need to make sure we change. Of course, we need to do much more than that, and this is why we support a Critical Medicines Act that would include all of these important components and all of these important changes. And I'll thank you very much.